Welcome to Med-Surg Tutor, and in this video, we'll be discussing preliminary urination. So let's jump right into it. All right, by starting with the basics. Urinary elimination is a critical process in the body. It's not just about getting rid of waste, it's also about how we maintain fluid balance and regulate blood pressure and keep the electrolytes in check. On average, we produce about 1,500 milliliters of urine a day, and that's the amount you would expect if you're well hydrated. But remember, urinary elimination is a system wide process involving the kidneys, ureters, bladders, and urethra. Each of these organs has this role to play in making sure that things move smoothly. Now let's break down the anatomy. The kidneys are the workhorses. They filter out waste, make urine, help regulate things like blood pressure and electrolytes. The ureters are just the tubes that carry the urine from the kidneys to the bladder, which is essentially a storage tank for the urine. A healthy bladder can hold about 400 to 600 milliliters before it signals the brain, hey, it's time for us to go. Finally, the urethra is the exit pathway for urine. And here's a tip, since the female urethra is much shorter than a male's, it puts females at higher risk for UTIs, which is something you definitely want to keep in mind when assessing these patients. Now, let's go over some common urinary issues you'll come across. First, retention is when the bladder doesn't empty fully, which can lead to discomfort and risk of infection. Incontinence is another big one. It's when a person can't hold their urine. There are different types, like stress incontinence, which is triggered by laughing or coughing, urge incontinence, which is a sudden or intense need to go, and overflow or functional incontinence, where physical limitations affect the ability to get to the bathroom. If a patient has a UTI, you'll notice burning, urgency, and maybe cloudy urine. Nocturia is when a person has to wake up multiple times during the night to urinate, which can be super disruptive. And finally, dysuria is simply pain or discomfort while urination, which is often seen in UTIs or bladder infections. Certain patients are at risk for urinary issues. Elderly patients often have decreased bladder control, increasing the risk of incontinence and UTIs. Pregnant women are at risk for incontinence due to the pressure on their bladder. Diabetics face a higher risk for UTIs due to high glucose levels. They also may experience neuropathy, which affects their bladder control. Post-operative patients, especially those who are immobile or under anesthesia, often struggle with voiding. Neurological disorders like spinal cord injury, stroke, or multiple sclerosis can disrupt normal bladder function, leading to retention or incontinence. And on this slide, I also have other things to keep in mind, such as indwelling catheters in obese patients. Now, assessment is key. Start by asking patients about their urinary habits. How often do they go? Any urgency or leakage? Next, inspect the urine. Check for color, odor, and clarity. You can learn a lot just by looking at it. Also, remember to measure intake and output. If the output is less than 30 milliliters per hour, it's a red flag. If you're worried about retention, use a bladder scanner to see if there's any leftover urine after they try to void. And don't forget about the labs. BUN, creatinine, and urinalysis can give you insights into kidney function and any potential infection. When it comes to diagnosing urinary issues, these are the tests you need to know. Urinalysis is a quick and easy test that looks for things like pH, glucose, and proteins. If you suspect an infection, a urine culture helps you identify the bacteria causing the UTI and pick up the right antibiotic. Bladder scans or a post void residual can tell you if there's any urine left after the patient urinates. For things like stones or tumors, imaging tests like ultrasounds or CT scans are your go to. And in more complicated cases, a cystoscopy Tracheostomy, sorry guys, I suck at pronunciation, allows the doctor to look directly inside the bladder. Collecting urine properly is a huge part of the assessment. For a clean catch, you'll want the patient to clean the areas first and then collect midstream urine to avoid contamination. If you're doing a 24-hour collection, you'll discard the first void and collect everything else for the next 24 hours, keeping it cold. If the patient can void on their own, you might want to use a straight cath to collect a sample. If the patient has a Foley catheter, you can get a sample from the port. Just make sure to clean it well and don't forget, label it clearly and get it to the lab promptly. Catheters are used for a variety of reasons. If a patient can't void on their own, needs accurate output measurement, or if they're having surgery, there are a few different types of catheters. A Foley catheter, which stays in, a suprapubic catheter, which is inserted through the abdomen, and a straight catheter, inserted for a one time use only. Insertion is a sterile procedure, so make sure you follow all the infection control guidelines. After insertion, you'll want to monitor for signs of infection, make sure there are no kinks in the tubing, and check for any leakage. And here we have some of the interventions that nurses would do when dealing with patients with urinary problems. So we'll want to include encourage fluids unless it's restricted, assist to the toilet or commode, promote perineal hygiene, bladder training, which is basically just making sure they're going on a schedule. So maybe every 2 hours, every 3 hours, whatever the patient may need. Monitor their I and O, their weight. This way you could check to see if they're hydrated or dehydrated. Labs, make sure you guys are paying attention to those. Skincare for incontinence. Remember, we want to reduce those pressure injuries. Manage catheter care and timely removal. The longer we keep them in, the higher the risk for infection. And teach lifestyle tips. So this will just depend on the patient's case, but some examples are avoiding caffeine and doing Kegels. Before we wrap up, let's talk about a few NCLEX tips. First, make sure you know normal urine output and what different urine colors can indicate. You also want to know different types of catheters and when each is used. And remember, don't overthink the questions. Think through the logic and consider what's most appropriate for the patient's needs. Review your assessment steps and diagnostic tests because those are often key parts of the exam. Know when to call the provider. Make sure you're assessing before you call the provider. And most of all, use that AdPi. That's going to come to your rescue every time. All right. Happy studying.